There are a number of problems that arise as men get older, and many very manageable if we catch them early. We do need better public awareness of some of these things, because we know that men's life expectancy is still lower than that of women. Big important things we need to consider are blood pressure, cholesterol, type 2 diabetes, largely because they all impact on the big problem of heart disease. But we also need to be really mindful of mental health, as this is a big problem for a lot of men and they don't seek help often enough. And also, classically, we talk about prostate problems becoming a bigger problem as we kind of go past the age of 40, and that causes a myriad of symptoms, which might be erectile problems, changes in mood and energy levels, low testosterone impact, that kind of thing. But the key message is that most of these things happen slowly over time, and if you come for regular check-ins with me as a GP, we'll pick it up early. Prostate health checks usually start from about the age of 40 to 50. As we know, the prostate tends to start growing from that age and causing some problems sometimes. There's a number of elements to a prostate health screen. Firstly and foremost, history is really important, and trying to pick up for any of those subtle signs that there's the change in the urinary system. Then there is a blood test called the PSA, the prostate-specific antigen, which is a very simple blood test. It's not perfect, but it can be a really good indicator of issues and help us detect things early. And then there's also a physical examination, a prostate exam, which is sometimes done and sometimes not, and that's something that we can always discuss and see how relevant that might be for an individual. But with prostate screening, I generally say it's a jigsaw puzzle, and we've got to ask the different elements and see the situation as a whole, and then we can work out if we need to get any further support with it. Lifestyle plays a huge role in men's health, far more than people probably put credit on. There's so much information out there at the minute with different diets, exercise regimes, so I think it can be really confusing and overwhelming for people these days. Fundamentally, get the foundations right. So I think looking at how people are exercising, whether it's regular, what the intensity is like, and then making sure that you've got a balanced diet, and good weight control, that your cholesterol levels are good, that your gut health is happy, and how your overall energy levels are. So yeah, lifestyle has a big impact on that. Furthermore, I think we also really need to see how stress and long-term stress can really impact on someone's health, and we need to take note of that. Chronic stress can affect sleep, it can affect your blood pressure, your mental health, your sexual function, your relationships at work and at home. And so, having someone look at that, support you with that, is really important. What's really helpful and good news is that there's small realistic changes that you can make that will have a big difference on those things. And what I always say to patients is that I'm looking for sustainable changes. I don't want you to go on a fad diet, etc. I want you to find something sustainable that's actually really going to work for you. Low testosterone can manifest in very subtle ways, and it's really easy to put down some of those symptoms to many other reasons. Feeling tired more often, a reduced libido, some erection problems, but even things like struggling to gain muscle mass, easily increasing your fat mass, and just generally feeling a bit more irritable or struggling to concentrate. So there's lots of ways that we could see that this would overlap with other conditions, mental health problems, along with many other reasons. So I think if someone is just seeing any of those signs or just feeling off from their baseline in general, it's worth exploring with a doctor whether testosterone might be part of the issue. Even if you're feeling well, I think it's important to have a check-in with a general practitioner, probably every year, but I think that changes depending on your needs, what's going on at the time and your age. But an annual basis is a good idea as a minimum. I think it's really helpful just to keep that relationship going with your GP so that they understand your world better, and that we can see you more holistically. But it gives us a good opportunity to keep a tight eye on blood pressure, weight, blood sugars, and thinking about the stresses in your life. And that means that we can, as you get older, pick up on those issues really early and prevent anything really wrong occurring.